Today we're going to be talking about a flap and the special considerations that you have to take into account when you are doing a flap. So a surgical flap is when you're lifting up tissue off the underlying tissue beneath it, and then at the end of the case you're going to be laying that flap back down and expecting it to readhere and revascularize to the tissue beneath it. So some examples of a surgical flap are when you're doing a tummy tuck and lifting up the abdominal wall and going all the way up to the xiphoid and out over the ribs laterally. If you're doing a radical neck, they're going to have that T incision here, and the flaps are going to be lifted off so they can work on the radical neck beneath it, and then at the end it's going to be reapproximated. And then you have your skin cancers where they may be doing a nasal flap or bringing a flap up over the nose, or the cheek flap. And then you also have your mastectomy when they're lifting up the dermal complex and removing the breast tissue and then readhering it down over the pec major. So these are examples of superficial flaps, and there are others. But then for the deep flaps, you have the ones like the tram flap, when they're taking the abdominal muscle, transrectus abdominal muscle, and putting it up with the skin and making new breast, or latissimus dorsi flap, when they're taking up the latissimus dorsi and using that to reconstruct the breast. So there are special considerations when you're doing a flap because there are some challenges for healing of it. Whenever the body has injury to it, is going to have an inflammatory response, and part of the result of that inflammatory response is going to bring fluid to the area, which you don't want when it's healing. Because if you have two layers, and I'm going to show you here, you have your flap here and you want it to adhere down to the tissue beneath it, and then you have fluid gather. As long as that fluid's between there, it's not going to heal down. And the best way I can example that I can use to translate to that is if I'm making strombolis at home and I have the bread dough down there and I lay the ingredients beneath it and has the fluid of the tomato sauce in it. If I go to pinch those edges together, they pinch together nicely as long as they're dry. As soon as some of that tomato sauce hits the edge of that dough, it will no longer seal itself. It slides, and then the ingredients will be bubbling out during the surgery. So that's kind of the same thing when you're doing a flap and you want it to heal at the end. If there's any fluid in there, it will not be able to adhere to the tissue and revascularize to the tissue beneath it. So you have to make sure that we are keeping that seroma, which is what the fluid collection is called, that we're keeping that seroma from forming, and we're keeping the two tissues adherent to each other. So how do we do that? Well, at the end of the case, they're going to be putting in a drain, and that drain is going to remain in as long as there is drainage. Here's a small example. When we're doing a tummy tuck, the surgeon that I work with will leave the drains in, usually a couple weeks, until there is less than 30 cc's of drainage in the grenades per 24 hours. So you're going to put a drain in it, and when you put that drain in, you want to put it in a dependent area because the fluid's going to migrate to the dependent area. So you want to make sure that that's where you place that drain, where the fluid's going to collect, and that you want to keep it, the vacuum intact and working. And then the second thing is you want to put there's always going to be a pressure dressing on these to keep that flap down adhered. So you're assisting with the healing process. When you put some sort of binder or an ACE wrap or whatever you're going to put on to put some pressure on that flap, you want to make sure that you put it strongly enough that it's going to give it some good snugness to it, but you don't want to put it so tight that it's now going to compromise the circulation to the flaps. So you want to do it just right. And usually if I'm putting like an abdominal one, you kind of, or neck one, you just kind of want to feel and make sure that you've got some good tension without it being too tight that it's going to compromise the circulation. And then you have a flap that should heal well. And it's the other thing with the seroma, just to add on, is that with the collection of the seroma, not only does it prevent the healing, but the seroma then acts in a warm, dark, moist environment, which we know is a good environment for germs to grow in, so they can end up with an infection. So that's the second reason you want to keep that seroma from forming.